I know from, us Health First being a managed care organization and really looking to, you know, get the right care at the right time, and really using any tools that are, available to us, to make sure that, again, the administrative waste and all of the, kind of the waiting and the collecting of information and all of that, like anything that can streamline the process. I know we're interested in, our company's interested in that naturally, but then, and then if you have, regulations coming down on top of it, I think our company's goal is to be positioned, even ahead of those regulations, where it's just in our DNA to operate that way, operate with that efficiency that the government's trying to push down. I know MCG has been a great partner in that respect and helping us have those tools in place. The reduction in time that it takes for us to approve a service. If we can auto approve a service, using the auto auth and those rules, if we can collect the clinical information up front without the back and forth, right? In terms of, they submit the request, comes back to us, we send it back to them for more information, they send it back to us, we tell them it's not enough, send it back, and so there's a lot of back and forth, and we've seen it. So, we want, and again, it's for us, it goes back to the member, not just the provider, but the member as well. So if a member needs a service, like, we want to make sure they're getting that service timely. They're not, beholden to the administrative aspect of it. If we can reduce that, yes, the providers are happy, we're happy, our members are happy, most importantly, and they're getting the service that they need. We use the integrated CareWeb QI interface. So, basically from a TrueCare, it goes from a review screen, you launch the criteria, it opens up the MCG page, you fill it out, you close the episode, and it sends it back to TrueCare in a summary note, with all the information that you have, which is very useful for, not only the person that's working on it, but anybody else that might be coming in to look at any, future information around the authorization. So it's a very nice, seamless integration. Along those lines, we use the Guideline modification module, especially in our pharmacy department. And I know, a lot of that is driven towards kind of making sure everything, kind of conforms to, I don't know if it's at the state level or if it's our own individual plan, but that customization really, helps us drive to make sure that the guidelines are, as they should be for our company. And so I've done a lot of work with the pharmacy department. So it's allowed us to take the out of the box guidelines and just tweak them a little bit, to basically make sure they conform to, whether it be our state regulations or our internal controls. And that's been an extremely helpful product. We've done, I would say, hundreds of those over the past couple of years. And especially our pharmacy department, and now our utilization management department is starting to use those as well. So, it's a really nice feature of the product.